World AIDS Day is held every year on December 1st and is an opportunity for people worldwide to reflect and unite against the fight against HIV. To me, World AIDS Day is an opportunity to come together as a community and change things.
This year's theme in the United States is "The time to act is now." That means getting to zero. Zero new HIV infections, zero HIV-related deaths, and zero discrimination, especially among young people.
First, allow us to introduce ourselves. My name is Mike. I am 27 years old, and I've been undetectable for 6 years.
My name is Lamar Yarwell. I am 23 years old, been living with HIV for 5 years, been undetectable for 3. I believe that youth should be empowered to solve problems that affect them the most.
Hi, my name's Jeremy Ford. I've been positive for 3 years, and I'm here to lend my voice to end HIV.
My name is Nina. I've been living with HIV for 32 years, and I really think that young people have some new ideas to end this epidemic.
My name is Brendan Allison. I'm 23, and I've been living with HIV a little over a year. It is my goal to make sure that every person diagnosed with HIV is able to access care, regardless of socioeconomic status, compassionately and affordably within the Metro Atlanta area.
My name is Daniel Driffin. I'm 29 years old, and I live in Atlanta, Georgia. My wish would be all youth who are living with HIV be able to access medical care for HIV, regardless of cause.
My name is Christian Dacus. I'm 29 years old, and I believe that the way to end this epidemic is through proper education.
My name's DeMonte Pettigrew, and I'm 20 years old. I've been HIV positive for 21 months, and out of those 21 months, I've been undetectable for 17. I hope to help eliminate the stigma as well as the spread of HIV in children, youth, and young adults.
My name is Masanya Traylor. I've been HIV positive for 5 years. I have 2 children, a son that's 12 years old, and then I have a 4-year-old daughter as well who was born HIV negative in 2011. My children's generation doesn't stand a chance in getting to zero without you.
3,000 people were diagnosed with HIV last year in Georgia.
While HIV is decreasing at the population at large, it's increasing among certain groups of youth.
Youth account for a quarter of all new HIV infections in the United States.
The youth are less likely than older people to be tested for HIV.
Atlanta ranks 5th among all metropolitan areas in new HIV diagnosis, according to CDC's latest reports.
CDC estimates that more than half of youth ages 13 to 24 living with HIV do not know their HIV status.
It gets worse. A year after diagnosis, only a third of youth are receiving treatment and medication in order to stay healthy and prevent new HIV infections.
Here is what we would like for you to know today and every day. We are young people living with HIV that want to make a difference.
We are surviving, thriving, and we deserve equal rights afforded to all Georgians.
We're the only ones who can really tell you what it means to live with HIV, and you need us to stop HIV.
Together, we can create the answers for prevention and care.
We are young, black, gay males living in a city that tolerates us, but has very few resources dedicated to our needs, especially those who sit at the nexus of all 3.
We are also young women who are mothers, caretakers, daughters, and aspiring careerists. We are also transgendered women who have experienced unparalleled levels of unemployment, discrimination, homelessness, and violence.
As our own representatives, we demand to serve as active participants in every level of decision-making pertaining to ending HIV in Atlanta.
This is not an unprecedented paradigm. The principle of self-representation, or nothing about us without us, is a commonly cited notion from the 1983 Denver Principles.
In accordance with this concept, we lay out these policy asks, which we know are crucial to overcoming the barriers that have kept Atlanta as an epicenter of the HIV crisis in the United States.
We declare the rights of youth living with HIV to be the following:
The chance to live a healthy and fulfilling life living with HIV.
The right to live without fear of criminalization based on our serostatus.
All youth should be able to access services related to HIV care and treatment.
No youth interested in HIV testing should ever be turned away prior to receiving services.
Healthcare providers must show dignity and respect for young people living with HIV.
Here are the facts. Have our backs.